morning, everybody. My name is Mike Anderson. This is our second video in a series of videos that we're going to do to get us into 2019, whereby we start talking about very serious issues pertaining to wellness, the science of wellness and nutrition, functional medicine, so some real-time information that patients are going to use to get themselves healthier for 2019. Today we're going to talk with Sam Mortensen. Hi, Sam.
Hi.
Sam is a graduate of Carroll University, where she has a degree in exercise science. She's also a certified massage therapist and a certified personal trainer. So from an exercise standpoint, she comes with a pretty good skill set. The reason why we have Sam here is to give our patients brief exercise prescriptions that are personalized, simple and progressive and quite effective, because Sam helps them to set goals and to make things all realistic for the patients. So Sam, let's talk about that. What's the best way for patients to set goals?
So for them to set goals for themselves, I like to recommend using the mnemonic SMART. So every letter will stand for something. So S is something specific, M is something measurable, A, it has to be attainable, R, it has to be relevant, and then T, it has to be time-based.
And can you give us an example of some of those?
Sure. So for something specific, it has to be something clear. So it can't be, I just want to get healthier. So it would be, I want to lose weight, or I will lose weight. Then for something measurable, you have to add an amount to that. So I want to lose however many pounds. So before you can add a number to that, you have to make sure that it's an attainable number. So people who are typically overweight, they can lose about 5 to 10% attainably. So I would say that I would lose 7% of my body weight. And it has to be relevant to how you're feeling right now. It has to be something important and something that you will stick to. So whether it be like a beach body, or you're too stressed over with the holidays and it's not going to be something that you will stick to right now. Then for T, for time-based, it has to be a deadline where you'll hold yourself accountable to it. So people can lose about 1 to 2 pounds a week healthily, and then I would say that I will lose about 7% of my body weight within 3 months.
Ooh, impressive.
Yeah.
And I have a hard time tracking when I'm exercising. How do you help patients track their progress?
So in my room, I like to give people programs. I've always thought that was the most helpful way. You can keep track of all the exercises you do month to month as I change and progress them. So they have little charts, and it'll be their exercise, their sets, their reps. I put a check mark if they did it fully or how many they were able to get to. If they changed their weight from like 8 pounds to 10 pounds, I put that change on there. So it's a whole record of everything that they've done within that time period. Otherwise, I know a lot of people like to use apps or like logs. So you can do the same thing at home and use like a little notebook, write how you feel. Otherwise, like My Fitness Pal, your Fitbit, like Weight Watchers, those are really great apps out there too. You just have to find something that works for you and how you plan to achieve your goal.
Awesome. Good information. So by the end of the year, Sam guarantees me that I'm going to look 20 years younger, and which will put me at age 16, so I'm looking forward to that. Sam, thank you very much for your information. It was very helpful.
Yeah, of course.
So Sam has been doing these exercise prescriptions here in the office for about 3 months now, and we've had a lot of success. And I think it comes in the simplicity of the exercises, the briefness of the prescriptions, and the measurable goals that Sam works with the patients. So Sam will be joining us in a few weeks as she demonstrates some of the low-tech exercises that she does here in the office. So we look forward to that. Coming up in the next video, we have Spencer, our lifestyle nutritional specialist, and she'll be talking about some of the basics of nutrition and wellness, and again, setting goals with setting up nutritional and diet plans, some of the different diet plans that are out there, diet quote unquote, and some very good relevant information as far as setting food goals and what types of foods are best, and she might even introduce a couple of recipes as well. So we look forward to that. Sam, thanks again.
Yeah, thanks you too.
And thank you, everybody. We'll look forward to seeing you soon.